The title of my research project is How Physical Activity Can Be Used to Improve the Neurophysiology and Brain Structure of Patients Suffering from Depression. Depression is defined as characterized by persistent sadness and a lack of interest or pleasure in previously rewarding or enjoyable activities. Currently in the United States, 18.5% of people suffer from some variation of clinically diagnosed depression, and depression is in the top 5 most common mental illnesses. Due to the prevalence that depression has in society, treatment options are being studied, including using physical activity. Physical activity has already been determined to positively impact mood and depression symptoms, but the purpose of this study is to focus on the change in neurophysiology when physical activity is used as long-term treatment plans. This study will focus on answering the research question that states, if physical activity is used as long-term treatment in clinically depressed patients, then the patient's neurophysiology will show the positive impacts. The first part of this study is selecting the test subjects. In total, 108 participants will be used. 36 participants will be diagnosed as clinically depressed and have severe depression. Another 36 participants will be diagnosed as clinically depressed and have mild depression. The last 36 participants will not have any mental health issues or any family history of depression. Once all participants are collected, they will be split into 3 teams following a single-blind randomized controlled trial. 3 teams will be created with 36 participants each. Team 1 will complete 1 hour of physical activity for 5 days a week and 1 hour of an active rest on the remaining 2 days. Team 2 will complete 1 hour of physical activity 3 days a week and maintain normal activity levels the remaining 4 days. Team 3 will be prescribed no additional physical activity and maintain their current physical activity levels. In addition to the prescribed workout, the participants will also meet weekly and will also have MRI brain scans during the initial interview and every 3 months following. Based on all the data collected, we would see a decrease in depression symptoms in Team 1 and Team 2, but not a significant decrease in depression symptoms in Team 3. We would also see a difference in the brain MRI scans where an experienced professional compared each individual's brain scan at the initial screening and the repeated 3-month scan. Also, the MRI scans between each teams would be compared. In conclusion, physical activity when used in treatment for depression showed significant improvements in depression symptoms compared to those without any treatment. Current research supports this theory and confirms physical activity and medication can be used as viable long-term treatments for clinical depression.